Hello, fellow Special Needs parents. Nadine here from the Special Needs Supermom podcast. And in this podcast, I talk about, choosing special needs care, and more specifically, what you need to know to make the right choice. The world of therapy is like a jungle. Seriously, so many, there are so many kinds of therapy, so many areas you could help your special needs child with. So it's really hard to figure out what the best possible care is for your kid. What will help your kids in the best possible way, what will be most beneficial. In this episode, I will give you therefore 5 criteria that can help you decide what to choose. Whether we're talking about special needs care for your kid with an autoimmune disease like juvenile arthritis, or whether your kid is struggling with a learning disability like dyslexia, there are like a ton of options. How do you know what the best possible solution is for your kid? I'm no medical specialist. So when it comes to medical treatments, the first person to go to, of course, is your child's specialist. They know, like no other people, what the possibilities are, what the prognosis can be, case studies, possible new meds. So especially when talking about something medical, they are the first to go to. However, that doesn't mean that you have to take their word as the gospel truth. Sometimes it can happen that you disagree with your doctor or wonder if there isn't a better option, may even heard of a better option, but your doctor is not acknowledging that. In that case, you can and should always ask for a second opinion. I want to give you 2 examples for this. The first one is Supergirl, now 16, has juvenile arthritis. And at the age of 11, she was really struggling. So she was on the drug called Antix, methotrexate. And it's a proven drug. They know it does the work. It can do the work. But she was already taking it for 6 years, and the flare-ups kept coming up quite often. She was out of school at least 25%, if not more, because too much pain, way too tired. And by this time, she already had therapy for 2 years just to deal with her weekly shot. Because an MTX shot can be quite painful because there's like this substance that helps preserve it, but it's kind of acid. So my daughter one day in therapy made a drawing, and it's like knives cutting through her legs. That's how her shot feel. Her specialist, however, said, but this is the best option. You just have to grind your teeth, white knuckle your way through it. It's just something you have to deal with. 11 years old, the side effects were at a certain moment outweighing the benefits. She hardly ate, had no energy left. And I went like, this isn't right. She's struggling so much, and here you are saying, this is the only way, you just have to deal with it. And luckily, I was we were member of a parent organization, and people told us this is not normal, there are way more options, get a referral, go for a second opinion. So we ended up at an academic hospital just an hour drive away, and their first response was, she's already on this drug for 6 years with these types of flare-ups so often. We're going to stop this immediately. And Supergirl didn't even think they were serious, because at the end of the 1 hour consult, she was like, so I really don't have to set the shot this coming Friday? And they're like, no, you don't. Because there actually is a thing called Antix intolerance. And especially the older doctors out there are like, yeah, but this is proven. It's of course the most cheap option because it's the oldest, one of the oldest drugs. But the first thing the medical specialist in the academic hospital said, this is not normal. She should have a totally different drug by now. So, it really paid off. A second example, Wonder Boy and his ADHD meds. So we lived in the States and in the Netherlands. And he's tried all the drugs out there. So it was a real long trial and error to finding out what the right fit was. Then we came to the Netherlands, we had to start all over again. Because he was on a drug that was not available in the Netherlands. And yet they're like, unfortunately with many diseases, they can't, just draw some blood and figure out this is the best drug for, you. So we had to try out a lot of different things. And then we found a solution, but, he would get older and it wasn't the right fit anymore. So it can change over time as well. Well, like with Supergirl, because the first few years the MTX was doing its work, it just didn't do it anymore after several years. So, but this is just medical treatment. So when it comes to medical treatment, of course, first ask your specialist. They studied for it. They have all the knowledge and all the data available. But if you don't agree or wonder if they're right, go for a second opinion. But then we just have special needs care in general. Aside from that, there are in so many ways you can support your special needs child with care. There is from speech therapy to a gazillion types of dyslexia programs to all kinds of coaches and therapists from that give animal therapy, creative therapy where you can paint, role play even. There is so much out there. And then you of course have all these kind of therapy for kids with physical challenges like hydrotherapy and whatnot. And then you have CGT and NLP and God knows how much there's out there. Seriously, you could fill your entire agenda, or better, your kids' entire agenda with all the therapy out there. Hey, let's just leave the playing and free time for when they're fixed or better. But if you're a special needs kid, you won't. It will always be there. All these options, all these promises, all your hopes, because of the pressure, the pressure is high to choose the right kind of therapy. Therefore, to help you find your way through the jungle, here are 5 points that can help you decide what is the best special needs care for your child. Number 1, of course, do your research. Check with your specialist. Check out parenting groups. Check out patient organizations. They often have a ton of information available out there that can help you figure out all the options out there. When we started the juvenile arthritis journey and the autism ADHD journey, we had no idea. And it was also really, really overwhelming. And of course you had the more clinical information from your doctor, but patient organizations and parent groups can give you a lot of information, especially the ones that already have been out there for a longer time. So check those. Ask around. What is, and this is important, a proven method that can help your kids? And I say proven method because there are a lot of dodgy players in the therapy field. There is a reason that you have specialists and proven methods with a ton of references on one hand, and Dutchy therapists that, have a nice way of talking, have a really colorful website, and it all looks really fun and great, but yet they have no credentials at hand. So do your research. Number 2 then, if you find out what's out there, choose the right form. Does the kind of therapy matches your child's personality? For instance, and of course it's different if your kid, needs a very specific kind of therapy, to do with physical improvements. But especially if it comes to, let's say, depression, a lot of special needs children, especially when they hit their teenage years, deal with a form of depression. And then it's so important that the kind of therapy you choose matches your child's personality. If you have a really creative kid, they probably benefit more from a creative therapy where they can have, perhaps paint their emotions. If you have a kid that is really an animal lover, like Supergirl, they could really benefit from animal therapy. There were, like 20 years ago, there was this really famous movie about a horse and a girl. I forgot the name. But if a special kid has a hard time expressing, trusting, animal therapy can be a wonderful thing. So choose the right form. Then, number 3, pick one. Pick one therapy. Especially when you're new to this, you want to help your kid, you want to fix your kid. So you're like, oh, we should do A and B and C and D. It's really hard because you found all this stuff out there that could possibly help your kid. But, like I said before, you could fill up their entire agenda, after school. So they already have hospital visits, school, and then even if they are able to play sport or not, you could fill the moment they leave school to the moment they go to bed with all sorts of therapy. But your kid needs to be a kid as well. Don't think, oh, we just will do as much as possible now, so later on in life they can. But your kid needs to be a kid as well. They need to have downtime. They need to be able to just have fun, play, be bored out of their mind. Because it's not only in their sleep that they process stuff. If they had a hard time, they had a bad hospital day, they had a hard time in school, they need to be able to chill and relax as well. Because that's when you recharge your batteries. So really be careful to not cramp your agenda with a ton of therapy, because your kid needs to relax as well. Number 4, is there a click? It sounds a little bit funny, but it is really important. Is there a click between your therapist, the therapist of your child, and your kid? If not, please stop. Yes, of course, you often need a few sessions. But seriously, if after session number 3, your kid still doesn't like the therapist, or, when they're a teenager, really think they're stupid and they hate them, don't force it on them, because you will only do more damage than helping your kid. If there's no click, there is no click. And especially when it comes to therapy, to help them mentally, it is so important that they feel understood and they feel heard. And if you keep on forcing them to go to a certain therapy and there is no progression, your kid hates it, you will do more damage than anything. Besides the fact that your kid will lose faith in all therapy, yeah, it's only this one, but if this doesn't win and you know, if this fails and you had to force them to go through like half a year of therapy and they hated it at the beginning, and after half a year they're like, I didn't see progression, I still feel like shit, excuse my language, the next solution you're going to offer, they're like, yeah, seriously, I tried that for a half a year, that didn't work either, so why should I do that? And with that comes, you know, they could lose faith in you. You're their parent. You should. The first thing you should do is listening. If your kid doesn't feel heard, you know, it can really do a lot of damage. They should be able to at least feel listened to, heard. You know, and it doesn't matter what the therapist thinks, because also they make money, but it doesn't matter what they think. It doesn't matter what your school thinks. It doesn't matter what your family thinks. It's about your kid. If there's no click, stop and move on. And that's number 5. Tip number 5. You can quit. You have permission to quit. If your kids hate it, like I said, if you don't see progression, stop it. You know, sometimes, of course, it takes time to see progression. But if you have the feeling, no, this is going nowhere, please stop it. For all the reasons I just told you. And find therapy. Frustrating as it is, it's often a trial and error kind of thing. You have to see what works for your kid and what doesn't. But there's no shame in stopping therapy and moving on. You know, at least you're trying. If it doesn't work, stop immediately. It's totally fine. Because, you know, if you go on, chances are next time your kids won't be so willing anymore to try a new therapy. So listen, acknowledge their feelings, analyze what happened, what went wrong, move on. So those were my 5 criteria to find the best possible special needs care for your kid. 1, do your research. 2, choose the right form that matches your kid's personality. 3, pick only one. Number 4, see if there is a click between the therapist and your child. And number 5, know when to quit. That's it for now. I hope you found this useful. Let me know in the comments. And you know, if you have a tip, feel free to share. And please do like, share, subscribe to the podcast, because it really helps other special needs parents to find this podcast as well. And of course, yes, makes me happy as well to know if you find it useful or not. So please let me know. Rate, review, subscribe, and I see you next time at the Special Needs Supermom podcast. Bye.